Welcome, future nurses! Today we've handpicked 50 nutrition NCLEX questions that have the highest chance of appearing on your exam. Trust me, these are the must-know questions that the NCLEX absolutely loves to repeat. Master these 50 high-yield nutrition questions, and I guarantee you that nothing outside of these topics will surprise you on exam day. If you've got these covered, you're ready to ace any nutrition question the NCLEX throws your way. Before we jump into these essential questions, I have great news for you. If you're determined to pass the NCLEX on your very first try, we've crafted the ultimate shortcut, our complete NCLEX review crash course. Here's what makes our course your best bet: 100 hours of engaging animated crash course videos to help you revise rapidly. Over 500 hours of recorded lectures covering 500 plus high-yield NCLEX topics, frequently tested by the board. Access to 5,000 previously tested NCLEX practice questions. 15 realistic mock tests to build your confidence and readiness. A comprehensive NCLEX ebook for quick revision of all key points. Best of all, we're offering an exclusive 70% discount right now, for a very limited time only. So don't wait. Enroll today and secure your guaranteed success. Now let's dive straight into the most important nutrition NCLEX questions. Let's start with a clinical situation that tests your understanding of nutritional priorities in cases of severe underweight. A nurse is conducting a full assessment of a client whose body mass index, BMI, is measured at 14. Based on this finding, which dietary intervention should the nurse expect the healthcare provider to recommend? Before choosing, let's look carefully at the available options. A. Offer only 2 meals per day. B. Limit the client's intake of fats and calories. C. Include high-protein, high-calorie nutritional supplements. D. Increase consumption of green, leafy vegetables. Now, let's walk through the best option for this undernourished client. Correct answer is C. Include high-protein, high-calorie nutritional supplements. Let's explore why this answer is correct and the others aren't. A BMI of 14 is alarmingly low. Remember, a normal BMI is around 18.5 to 24.9. So this client is severely underweight, possibly at risk of organ failure or muscle wasting. At this point, the priority is to restore weight and nutritional status. That means giving the body calories and protein, not restricting them. So high-calorie shakes, protein-rich snacks, and frequent meals are key here. Let's break down the distractors. A. 2 meals per day is far too little. Severely underweight clients often need small, frequent meals. B. Limiting calories and fats would worsen their condition. D. Green leafy vegetables are healthy, but too low in calories to help this client gain weight. So again, this is about nutritional rebuilding, and protein plus calories are essential. Let's shift to the next scenario, a nutrition-related vitamin deficiency in a vegan client. This next scenario addresses the importance of micronutrients, especially for clients on restrictive diets. A nurse is counseling a client who has recently adopted a strict vegan diet. Which vitamin should the nurse emphasize the importance of including in the client's nutrition plan? Let's look at the choices to see which vitamin matters most in this context. A. Vitamin C, B. Vitamin B12, C. Vitamin A, D. Vitamin D. Now that we've seen the list, let's work through the right choice. Correct answer is B. Vitamin B12. Let's explain why this is the vitamin we're most concerned about. Vitamin B12 is only found naturally in animal products, things like meat, dairy, and eggs. So when someone goes completely vegan, this vitamin becomes the most common deficiency risk. Why does it matter? A B12 deficiency can lead to anemia, nerve damage, and even cognitive decline. That's serious and easily preventable with fortified foods or supplements. Now let's break down the wrong options. A. Vitamin C is abundant in fruits and vegetables. No issue here. C. Vitamin A is present in many plant foods like carrots and spinach. D. Vitamin D is less available in plants, but sunlight and fortified foods often make up for it. So again, vitamin B12 is the one vegans really need to plan for. Now let's switch gears and look at a dietary progression from clear to full liquids. Let's now look at a dietary progression scenario, which helps assess your knowledge of therapeutic diets. A nurse is caring for a client who has successfully progressed through a clear liquid diet. The provider has now advanced the client to a full liquid diet. Which of the following options should the nurse introduce that is specific to a full liquid diet and not typically part of a clear liquid diet? Take a look at the options before we decide. A. Gelatin. B. Tea. C. Custard. D. Apple juice. Let's now figure out which food belongs to a full but not clear liquid diet. Correct answer is C. Custard. Here's how to reason this one out. A clear liquid diet includes things you can see through: apple juice, broth, gelatin, tea. But a full liquid diet goes a step further. It includes liquids that are opaque or creamy, like custard, pudding, milk, and cream soups. So when the diet advances, you're introducing more calories and protein while still keeping everything in liquid form. Options A, B, and D, all part of the clear liquid phase, so they wouldn't mark a progression. Only custard shows that advancement. Let's continue with a question about clients who need a soft diet for chewing issues. This next question tests your ability to match texture modification with client needs. In this case, chewing difficulty. A nurse is teaching a client who has been placed on a soft diet due to difficulty chewing. Which of the following foods should the nurse recommend? Let's go over the options. A. Chunky peanut butter. B. Raw carrots. C. Applesauce. D. Beef jerky. Let's talk through the answer together. Correct answer is C. Applesauce. Here's why this is the safest choice. A soft diet is used for clients with chewing problems, maybe after jaw surgery or dental issues. So we need foods that are easy to chew and swallow, and applesauce fits that perfectly: smooth, gentle, and nutrient-rich. Let's look at the others. A. Chunky peanut butter, too sticky and risky. B. Raw carrots, too hard and crunchy. D. Beef jerky, way too tough for someone with chewing issues. So, whenever you see soft diet, think smooth textures, like mashed potatoes, cooked cereal, yogurt, and yes, applesauce. Now let's move into a renal diet scenario, where potassium and sodium levels are critical. Finally, let's wrap up with a question focused on renal diet restrictions, especially potassium. A nurse is assisting a client with end-stage renal disease, ESRD, in selecting appropriate food choices for their renal diet. Which of the following items should the nurse recommend? Here are your options. A. Applesauce. B. Cantaloupe. C. Fresh tomato slices. D. Veggie burger patty. Let's work through the best food choice for someone on a strict renal diet. Correct answer is A. Applesauce. Let's go over why this is the safest choice. Clients with ESRD need to limit potassium, phosphorus, and sodium because their kidneys can't filter these properly. Applesauce is low in potassium and sodium, so it's perfect. Now let's go through the other options. B. Cantaloupe, very high in potassium. C. Tomatoes, also potassium-rich. D. Veggie burger. Sounds healthy, but often loaded with sodium and hidden potassium. So in this case, simple and bland is safe. Applesauce wins. Let's begin with a scenario that checks your ability to match dietary prescriptions with a client's physical limitations. A nurse is caring for a client who is edentulous, lacking teeth. Which of the following dietary prescriptions would be most appropriate for this client? Before we make our decision, let's review the choices available. A. Low sodium diet. B. Mechanical soft diet. C. Renal diet. D. High fiber diet. Let's figure out the most logical and practical option based on the client's condition. Correct answer is B. Mechanical soft diet. Let's walk through why this is the best answer. If a client is edentulous, that means they have no teeth. So chewing regular solid foods becomes difficult and even risky. The goal here is to provide nutrition in a form that's easy to manage and swallow, and that's exactly what a mechanical soft diet offers. This diet includes foods like soft cooked veggies, mashed fruits, and tender meats that require minimal chewing but still offer nutritional value. Let's look at the others. A. Low sodium diet. More about managing conditions like hypertension, not chewing ability. C. Renal diet. Designed for kidney patients, not related to chewing. D. High fiber diet. may include hard-to-chew items like raw veggies and whole grains, not ideal for someone without teeth. So, for any client with chewing challenges, especially edentulous ones, mechanical soft or pureed diets are the way to go. Let's move on to the next question, which focuses on managing gas and bloating through food choices. Now let's take a look at a nutrition question involving digestive discomfort and flatulence. A 25-year-old client presents with a history of intermittent abdominal discomfort, bloating, and increased flatulence for several months. Which food item should the nurse recommend the client avoid to minimize symptoms? Let's review the possible choices. A. High-fiber grains. B. Broccoli. C. Yogurt. D. Simple sugars. Let's analyze which of these foods is most likely to worsen symptoms. Correct answer is B. Broccoli. Let's understand why this choice makes sense. Broccoli is a cruciferous vegetable, and while it's healthy, it also produces a lot of gas during digestion. That makes it a common culprit for bloating and flatulence. The other choices? A. High-fiber grains. These help digestion if introduced gradually. C. Yogurt. Usually contains probiotics. Good for gut health, unless the person is lactose intolerant. D. Simple sugars. Generally easier to digest than fiber or complex carbs. So for a client with bloating and gas complaints, broccoli is best avoided. Let's move to the next case. One focused on iron deficiency anemia. Now let's work through a case where a nurse is checking how well a client understands iron-rich nutrition. A home health nurse is educating a client recently diagnosed with iron deficiency anemia about proper nutrition. Which of the following meal choices demonstrates that the client understands the dietary recommendations? Let's take a look at the options first. A. Cucumber salad with shredded carrots and balsamic vinaigrette. B. Cheese omelet with buttered toast. C. Lentil soup accompanied by garlic bread. D. Beef liver served with sautéed kale and wild rice. Now, let's choose the most iron-packed meal. Correct answer is D. Beef liver served with sautéed kale and wild rice. Here's why this is the best option. This meal includes beef liver, which is rich in Heme iron, the kind most easily absorbed by the body. The kale and wild rice contribute non-Heme iron and other nutrients that complement absorption. The other options? A. Not much iron at all. B. Eggs offer small amounts of iron, but not enough. C. Lentils are good for non-heme iron, but the overall meal isn't strong enough in iron content. So when teaching clients with anemia, focus on heme iron-rich foods, especially from meats like liver or beef. Next, let's take on a pediatric case involving rickets. Now we'll shift focus to a common pediatric nutrition condition, rickets. A pediatric client is diagnosed with rickets. Which nutritional intervention should the nurse include in the plan of care? Let's go through the choices first. A. Encourage foods high in vitamin D to support bone health. B. Reduce intake of calcium-rich foods to prevent complications. C. Increase phosphorus-rich food intake as a primary treatment. D. Emphasize a high-protein diet for bone repair. Let's find the option that directly targets the root cause of rickets. Correct answer is A. Encourage foods high in vitamin D to support bone health. Here's why this is the most appropriate intervention. Rickets is caused by a vitamin D deficiency, which impairs the body's ability to absorb calcium, leading to soft, weak bones. So the first thing we need to do is boost vitamin D through foods like fortified milk, eggs, and fish oils, or through supplements. Let's clear up the incorrect choices. B. Reducing calcium? No way! We need calcium to strengthen bones. C. Phosphorus helps, but vitamin D is the key. D. Protein is great for growth, but not the main issue in rickets. So for this pediatric case, it's all about vitamin D for calcium absorption and bone health. Now let's explore how we evaluate a client's nutritional status. Let's look at a question that evaluates your ability to choose the right assessment tool. For a nurse is evaluating a client's nutritional status during an initial assessment. Which of the following tools is most appropriate for assessing nutritional status in this client? Let's review the choices. A. Klein-Bell Activities of Daily Living Scale. B. Barthel Index of Functional Independence. C. Wong-Baker, FACES Pain Rating Scale. D. Patient-Generated Subjective Global Assessment. Let's determine which tool is built specifically for nutritional evaluation. D. Patient-generated subjective global assessment. Here's why this is the most accurate tool. The PGSGA is a well-established nutritional screening tool, especially used for cancer patients, that evaluates weight changes, food intake, symptoms, and functional status. It even includes a short form the patient can fill out themselves. Let's eliminate the others. A. Klein-Bell measures daily living tasks, not nutrition. B. Barthel Index looks at independence and mobility. C. Wong-Baker Faces is a pain scale, mostly for children. So, to assess nutrition in any comprehensive way, go with the PGSGA. Let's finish up with two more quick but crucial questions. One on hypertension, the other on sodium-restricted diets. Now let's look at a client newly diagnosed with hypertension and how they interpret dietary advice. The nurse is providing dietary education to a client newly diagnosed with hypertension. Which client's statement indicates a need for further teaching? Let's hear what the client might say. A. I'm happy I can still eat beef and pork every day. B. I'll start adding more fruits and vegetables to my meals. C. I should steer clear of canned foods. D. I asked my spouse to pick up some yogurt for me. Now let's identify the red flag statement. Correct answer is A. I'm happy I can still eat beef and pork every day. Let's walk through why this statement is a problem. This response reflects a misunderstanding of hypertension diet guidelines. Beef and pork are often high in saturated fat, which can raise blood pressure and worsen cardiovascular health. Daily consumption is not recommended. The other options? B. Fruits and veggies are great. C. Yes. Canned foods are often high in sodium. D. Low-fat yogurt is DASH-friendly. So again, answer A tells us the client needs more teaching. And finally, let's look at seasonings for a low-sodium diet. Now we'll talk about low-sodium diets and how to educate clients on flavor without salt. A nurse is educating a client on a low-sodium diet about which condiments and seasonings are appropriate to enhance food flavor. Which of the following should the nurse recommend? Here are the choices. A. You can dip your food in soy sauce for added taste. B. Ketchup is a great way to boost flavor. C. Try adding fresh rosemary to bring out the flavor in your meals. D. Steak sauce is a flavorful option you can use regularly. Let's find the best low-sodium option. Correct answer is C. Try adding fresh rosemary to bring out the flavor in your meals. Let's explain why this is the best recommendation. Fresh herbs like rosemary are naturally low in sodium and add a ton of flavor. Rosemary specifically contains only about 26 milligrams of sodium per 100 grams. Very little. Let's look at what to avoid. A. Soy sauce. A single teaspoon has over 850 milligrams of sodium. B. Ketchup. About 150 plus milligrams of sodium per tablespoon. D. Steak sauce. Nearly 280 milligrams per tablespoon. So again, when teaching low-sodium options, focus on herbs, spices, lemon juice, and vinegar, not salty condiments. Let's dive into a situation involving dietary advice for a client with an ileostomy concerned about odor control. A nurse is providing dietary guidance to a client with an ileostomy who expresses concern about having a strong and unpleasant odor. Which of the following foods should the nurse advise the client to avoid to help minimize this issue? Let's review the available options. A. Buttermilk. B. Parsley. C. Yogurt. D. Eggs. Now, let's work through which food is most likely to increase odor. Correct answer. D. Eggs. Here's why this is the correct choice. Eggs are among a group of foods known to increase stool odor and gas production, particularly problematic for clients with an ileostomy. Others in this category include asparagus, alcohol, fish, onions, cabbage, and grapes. These foods create unpleasant smells when digested, which may make ostomy care more distressing. Now let's break down the incorrect options. A. Buttermilk. This is actually helpful. It works as a natural deodorizer and reduces odor. B. Parsley. Parsley has odor-neutralizing properties and may improve digestive freshness. C. Yogurt. Especially those with live active cultures can reduce gas and support healthy digestion. Clients should also be advised to avoid habits that increase air swallowing, such as chewing gum or drinking through straws, as this can increase gas. Helpful dietary practices include drinking cranberry juice and using odor control products in their pouch. Now let's take a closer look at a case of nutritional management in an underweight client. A nurse is assessing a client whose body mass index, BMI, is calculated to be 17. Which type of diet should the nurse anticipate being prescribed to help address this finding? Here are the dietary options. A. Diet low in fat. B. Protein-restricted diet. C. Diet rich in calories. D. Low-sodium meal plan. Let's analyze which intervention is best for promoting healthy weight gain. Correct answer, C. Diet rich in calories. Why this choice? A BMI of 17 places the client in the underweight category. The main priority here is to help the client reach a healthy BMI range, 18.5 to 24.9, which requires a calorically dense and nutritionally complete diet. Foods like nut butters, whole milk, gravies, and creamy soups are ideal for boosting energy intake. Let's go through the other options. A. Low-fat diet. Inappropriate here, as healthy fats are essential for gaining weight. B. Protein-restricted diet. Would hinder tissue repair and is not suitable for underweight individuals. D. Low-sodium diet. Not relevant unless the client also has fluid retention or cardiovascular issues. Always consider the root causes of low BMI, such as chronic illness or poor nutrient absorption. Regular follow-ups and dietary planning should accompany the weight gain strategy. Let's move to another important condition: food intolerance that causes GI symptoms. A nurse evaluates a client who reports abdominal cramping, bloating, and loose stools that typically occur after consuming milk. Based on these symptoms, which condition is the nurse most likely to suspect? Review the options carefully. A. Chronic pancreatitis. B. Gluten-sensitive enteropathy, celiac disease. C. Lactose enzyme deficiency, lactose intolerance. D. Peptic ulcer disease. Let's reason our way to the correct diagnosis. Correct answer, C. Lactose enzyme deficiency, lactose intolerance. What's the logic here? This client's symptoms, bloating, cramping, and loose stools after milk, are classic for lactose intolerance, which results from insufficient levels of lactase. Lactase is the enzyme responsible for breaking down lactose, a sugar found in dairy. Without it, digestion is impaired, leading to gastrointestinal upset. Now the distractors. A. Chronic pancreatitis. Causes abdominal pain but is not tied to dairy intake. B. Celiac disease. Triggered by gluten, not lactose. Those symptoms may seem similar. D. Peptic ulcer disease. Causes epigastric pain and may be worsened by spicy or acidic foods, not dairy. Encourage the use of lactose-free dairy, enzyme tablets, and calcium-rich alternatives. Consider a referral to a dietitian to prevent nutritional deficiencies while avoiding symptoms. Lactose intolerance is extremely common, especially among non-Caucasian populations. Let's revisit the issue of chronic constipation, a very common but manageable problem through proper diet. A nurse is educating a client who suffers from long-term constipation. Which meal option would most effectively support regular bowel movements? Take a look at these options. A. Grilled steak with a baked potato. B. Steamed Brussels, sprouts served with a whole grain roll. C. Chicken breast with plain white rice. D. Ham sandwich accompanied by tomato soup. Now, let's find out which meal best promotes bowel regularity. Correct answer, B. Steamed Brussels sprouts served with a whole grain roll. Let's explore why this choice is ideal. Brussels sprouts are a cruciferous vegetable, rich in insoluble fiber, while the whole grain roll adds bulk to the stool. This combination stimulates intestinal motility, easing constipation. A high-fiber diet is one of the first-line interventions for chronic constipation, especially when paired with adequate hydration. Now let's rule out the distractors. A. Grilled steak with a baked potato. Unless the potato skin is eaten, this meal lacks fiber and includes red meat, which can contribute to slower transit time. C. Chicken with white rice. Both are low in fiber and don't help much in promoting bowel movements. D. Ham sandwich and tomato soup. Processed meats and soups are often low in fiber and high in sodium, which isn't helpful for constipation. Encourage clients to eat regular meals, drink 8 to 10 cups of water daily, and increase physical activity, all of which can help stimulate regular bowel habits. Now let's turn our attention to a respiratory-related nutrition scenario. The nurse is caring for a patient diagnosed with severe chronic obstructive pulmonary disease, COPD. Which of the following meal options is most appropriate for meeting this patient's nutritional needs while minimizing respiratory effort? Here are the meal options to consider. A. Cut apples, fresh broccoli, and grilled chicken. B. Pureed sweet potatoes, ground turkey with gravy, and mashed potatoes. C. Green beans, boiled carrots, and steamed fish. D. Fried chicken, French fries, and pudding. Let's identify the most suitable meal for a client with advanced COPD. Correct answer, B. Pureed sweet potatoes, ground turkey with gravy, and mashed potatoes. Why is this best? Clients with severe COPD expend a lot of energy just to breathe. Even chewing can be exhausting. Soft, calorie-dense meals like pureed and mashed foods require less effort to chew and swallow, making meals easier and less taxing. Option B offers balanced nutrition while supporting easier consumption. Let's evaluate the other options. A. Apples and broccoli. Raw fruits and veggies require significant chewing, which may increase dyspnea. C. Green beans and steamed fish. While nutritious, this meal is not as soft or energy-dense as option B. D. Fried chicken and fries. High in fat, low in nutrient density, and hard to chew. Not suitable for COPD clients. In COPD management, small, frequent meals and nutrient-dense soft foods can prevent fatigue during eating while ensuring caloric needs are met. Now let's dive into a common concern in colostomy care: excess gas. A nurse is caring for a patient with a colostomy who reports experiencing excessive gas. To identify the potential cause, the nurse asks the patient to recall their dietary intake over the past 48 hours. Based on typical gas-producing foods, which of the following combinations is most likely contributing to the patient's symptoms? Here are the options. A. Caraway seeds, tomato soup, and eggs. B. Chicken, grapes, and raspberries. C. Squash, spinach, and pickles. D. Cherries, radishes, and watermelon. Let's find the most likely gas-producing combination. Correct answer, D. Cherries, radishes, and watermelon. Here's why. All three foods are known to increase gas production. Cherries and watermelon contain fermentable sugars, like sorbitol and fructose, while radishes contain raffinose, a gas-forming complex carbohydrate. This trio is a classic example of foods that colostomy clients may need to limit to reduce discomfort from gas. Now, for the distractors, A. Caraway seeds, tomato soup, and eggs. These are not common culprits for gas and are generally well tolerated. B. Chicken, grapes, and raspberries. Chicken is neutral, and while grapes and raspberries have some fiber, they don't usually cause excessive gas. C. Squash, spinach, and pickles. These are gentle on the gut and not high in fermentable sugars. Encourage colostomy clients to keep a food journal to track symptom patterns. This empowers them to identify personal triggers and fine-tune their diet accordingly. Let's now look at a client education scenario involving sodium restriction for heart failure. The nurse is educating a client diagnosed with congestive heart failure, CHF, about appropriate dietary choices. Which of the following seasoning options is most appropriate for the client to use on a daily basis? Here are the options. A. Onion salt and garlic powder. B. Ginger and bay leaves. C. Sea salt and black pepper. D. Garlic sodium and nutmeg. Let's determine which seasoning supports the dietary needs of someone with CHF. Correct answer, B. Ginger and bay leaves. Here's why this is the right choice. Clients with CHF are typically instructed to follow a sodium-restricted diet in order to minimize fluid retention and decrease cardiac workload. Ginger and bay leaves are flavorful herbs that are completely sodium-free, making them ideal choices for seasoning food without adding salt. Now let's examine why the other options don't work. A. Onion salt and garlic powder. Onion salt contains added sodium, and even garlic powder can sometimes include hidden sodium, not suitable for daily use. C. Sea salt and black pepper. Sea salt, although marketed as a healthier alternative, still contains sodium and should be avoided in CHF. D. Garlic, sodium, and nutmeg. Garlic sodium clearly adds salt content. Nutmeg is neutral, but doesn't counteract the sodium. Encourage patients with CHF to flavor foods with herbs, citrus, and salt-free spice blends. Educating clients to read labels and avoid hidden sodium is also essential in managing CHF. Now let's move to a metabolic disorder that often surprises clients. Gout. The nurse is educating a client recently diagnosed with gout about dietary modifications. Which type of diet should the nurse emphasize to help prevent further gout attacks? Let's look at the dietary approaches. A. Diet rich in calcium. B. Diet adjusted for potassium levels. C. Diet low in purine-containing foods. D. Standard renal-friendly diet. Which of these best addresses the underlying cause of gout? Correct answer, C. Diet low in purine-containing foods. Here's the reasoning. Gout is caused by the accumulation of uric acid crystals in joints, which result from the breakdown of purines. A diet low in purine helps reduce uric acid production and lowers the risk of painful flare-ups. The nurse should educate the client to limit intake of red meat, organ meats, shellfish, and alcohol, especially beer. Let's review the incorrect options. A. Calcium-rich diet. Beneficial for bone health, but not relevant to gout. B. Potassium level adjustments. Typically linked to cardiac or renal concerns, not uric acid. D. Renal diet. While useful in kidney disease, it doesn't specifically target purine metabolism. Clients should also increase fluid intake and maintain a healthy weight. Allopurinol or colchicine may be prescribed, but dietary management is the foundation of long-term control. Let's now examine a dietary restriction related to endocrine dysfunction. The nurse is reviewing the dietary plan of a client who has been prescribed a low-potassium diet. The meal plan includes options like applesauce, green beans, cabbage, lettuce, grapes, and raspberries. Based on this information, which type of client is most likely following this dietary restriction? Options include A. A client diagnosed with heart disease. B. A client with osteoporosis. C. A client with Addison's disease. D. A client who underwent recent gastric bypass surgery. Let's analyze this further to find the most fitting match. Correct answer, C. A client with Addison's disease. Here's why. Addison's disease involves insufficient production of cortisol and aldosterone. Aldosterone normally helps the kidneys excrete potassium, so its deficiency leads to potassium retention, hyperkalemia. To manage this, clients are often advised to follow a low-potassium diet, and the foods listed, such as applesauce and cabbage, are low in potassium. Let's understand why the other choices are incorrect. A. Heart disease. While sodium restriction is common in heart disease, potassium restriction is not routine unless accompanied by renal complications. B. Osteoporosis. No link to potassium control here. Calcium and vitamin D are the dietary priorities. D. Gastric bypass. These clients typically follow a low-volume, nutrient-rich diet, but not specifically potassium-restricted. Nurses should routinely monitor potassium levels in clients with Addison's and reinforce low-potassium food choices. Clients may also require fludrocortisone to help regulate electrolyte balance. Let's now talk about a case of anemia and how nutrition can directly improve the client's condition. A nurse is educating a client diagnosed with anemia about dietary modifications to improve iron levels. Which meal plan should the nurse recommend to best support iron intake? Options. A. Grains, berries, and organically grown vegetables. B. Vegetables, fish, and refined pasta. C. Nuts, seeds, assorted fruits, and soy-based items. D. Legumes, organ meats, and dark green leafy vegetables. Let's walk through the most beneficial choice for boosting iron levels. Correct answer, D. Legumes, organ meats, and dark green leafy vegetables. Here's why. Clients with anemia need iron-rich foods to support red blood cell production and oxygen transport. Organ meats provide heme iron, which is the most bioavailable form. Legumes and leafy greens contribute non-heme iron, which, while less easily absorbed, is still important, especially when paired with vitamin C-rich foods for better absorption. Now, let's break down the distractors. A. Grains, berries, and organic vegetables. While generally nutritious, these foods are not particularly high in iron. B. Vegetables, fish, and refined pasta. Fish offers some iron, but refined pasta and most vegetables are not reliable iron sources. C. Nuts, seeds, and fruits. These are rich in healthy fats and fiber, but not significant for iron intake. Educate clients to pair iron-rich foods with vitamin C, like citrus or tomatoes, to enhance absorption. Also, limit intake of tea or calcium-rich items near iron-rich meals, as these inhibit absorption. Let's move on to a question involving dietary restrictions based on personal food preferences, specifically vegetarian diets. The nurse is caring for a client who follows a lacto-ovo-vegetarian diet. Which meal option is appropriate for this client's dietary preferences? Choices: A. Fish, milk, and poached eggs. B. Chicken, cheese, and grilled eggplant. C. Boiled eggs and chocolate milk. D. Oysters, yogurt, and turkey. Let's narrow in on the best fit. Correct answer: C. Boiled eggs and chocolate milk. Here's the logic. A lacto-ovo-vegetarian eats dairy, lacto, and eggs, ovo, but does not consume any meat, poultry, or seafood. Option C contains no animal flesh and includes both milk and eggs, which are permitted. Let's walk through why the others are incorrect. A. Fish. Not allowed on a lacto-ovo-vegetarian diet. B. Chicken. Also excluded due to being poultry. D. Oysters and turkey. Both are meat sources and therefore not suitable. Lacto-ovo-vegetarian diets can still provide all essential amino acids if well planned. Encourage protein variety and B12 supplementation if needed. Finally, let's look at a scenario involving physical limitations and safe food textures. A nurse is caring for a patient with a fractured mandible, broken jaw. Which of the following food options would be most appropriate to include in this patient's diet plan? Options: A. Carrots, fried chicken, and dry cereal. B. Soup, pudding, and ice cream. C. Rice, watermelon, and smoked fish. D. Tacos, peanuts, and fresh broccoli. Correct answer: B. Soup, pudding, and ice cream. Why this option? Clients with jaw fractures require soft, non-chew diets to avoid strain and promote healing. Foods like soup and pudding are smooth and easy to consume with minimal effort. Ice cream also provides calories while being gentle on the jaw. Let's walk through why the other options should be avoided. A. Carrots and cereal. Too hard and crunchy for a healing jaw. C. Smoked fish and rice. May still require moderate chewing effort. D. Tacos, peanuts, broccoli. Crunchy and difficult to manage with jaw instability. If the client has jaw wiring or severe pain, consider a full liquid diet and consult with a speech or dietitian specialist for safe food modifications. Let's move into a dietary education scenario for a client undergoing dialysis. A nurse is educating a client with chronic kidney disease who is undergoing dialysis about appropriate dietary choices. Which type of food selection should the nurse advise the client to avoid? Options: A. Fresh fruits and vegetables, grilled chicken and lentils. B. Steamed broccoli, broiled fish, and low-calorie sweeteners. C. Microwaved sweet potatoes, boiled cabbage, and artichokes. D. Canned soups, deli meat sandwiches, and Chinese takeout. Correct answer: D. Canned soups, deli meat sandwiches, and Chinese takeout. Why? These food choices are all notoriously high in sodium. Clients on dialysis often have impaired sodium excretion, which can lead to fluid overload, elevated blood pressure, and worsened renal function. Sodium restriction is a critical part of dietary management for kidney disease. Let's walk through why the other options are not the best answer. A. Fresh fruits, veggies, grilled chicken, and lentils. Generally considered healthy, though lentils are high in potassium and phosphorus, so moderation is key, not complete avoidance. B. Broccoli and fish. These are lower sodium options, suitable with proper portion control. C. Sweet potatoes and cabbage. May require monitoring for potassium, but not typically avoided entirely unless hyperkalemia is present. Always check labels for hidden sodium sources. Encourage home-cooked meals with herbs for flavor instead of salt. Patients may also need to limit potassium and phosphorus depending on lab results. Next, we focus on dietary progression for a patient recovering from diverticulitis. The nurse is caring for a patient recently admitted with acute diverticulitis. After the patient successfully tolerates a full liquid diet, the healthcare provider updates the dietary order. Which of the following meals should the nurse expect to see on the patient's lunch tray? Options: A. Glass of whole milk, steamed broccoli, and cabbage. B. Peanut butter sandwich, glass of milk, and fresh strawberries. C. French fries, chicken salad, and apple pie. D. Slice of white bread, skinless white potatoes, and plain white rice. Correct answer: D. Slice of white bread, skinless white potatoes, and plain white rice. Why? This meal represents a low-residue, low-fiber diet, which is essential in the healing phase of diverticulitis. It gives the bowel time to recover without added mechanical stress from insoluble fibers. Now for the incorrect choices. A. Milk and broccoli. Broccoli and cabbage are high in fiber and gas-producing, which can irritate the healing colon. B. Peanut butter and strawberries. Seeds and fiber in. Strawberries, along with peanut butter, are not ideal during early recovery. C. Fried food and salad. High-fat, heavy meals like fries and mayonnaise-based chicken salad are best avoided. Clinical insight: once symptoms improve and healing progresses, clients may be slowly transitioned to a high-fiber diet to help prevent future flare-ups. Let's explore a drug-diet interaction involving potassium-sparing diuretics. A nurse is educating a client who has just been prescribed the potassium-sparing diuretic spironolactone. Which food should the nurse instruct the client to consume in limited amounts due to the risk of elevated potassium levels? The nurse reviews the following foods: A. Eggs. B. Green leafy vegetables. C. Bananas. D. Hot dogs. Correct answer: C. Bananas. Here's the rationale. Bananas are well known for being high in potassium. Spironolactone retains potassium, unlike other diuretics which waste it. So adding more potassium-rich foods increases the risk of hyperkalemia, which can lead to arrhythmias and cardiac issues. What about the distractors? A. Eggs contain minimal potassium. B. Leafy greens varies depending on the type, but not as dangerous as bananas unless consumed excessively. D. Hot dogs may be high in sodium and saturated fat, but not a potassium concern. Teach clients to watch for signs of hyperkalemia, such as muscle weakness, fatigue, or irregular heartbeat, and to report them promptly. Let's turn our attention to medication-diet interactions in anticoagulant therapy. A nurse is educating a patient who has been newly diagnosed with deep vein thrombosis, DVT, and started on warfarin Coumadin therapy. During dietary counseling, the nurse emphasizes the importance of avoiding which of the following foods due to its potential to interfere with the medication's effectiveness. A. Bananas. B. Lettuce. C. Spinach. D. Processed meats. Correct answer: C. Spinach. Why? Spinach is extremely rich in vitamin K, which can antagonize the effects of warfarin, decreasing its ability to prevent clot formation. Consistency in vitamin K intake is crucial. Sudden increases can render the medication less effective. Reviewing the distractors. A. Bananas. No significant effect on warfarin. B. Lettuce. Contains some vitamin K, but far less than spinach. D. Processed meats. Not relevant to warfarin metabolism. Educate clients to avoid drastic dietary changes and to communicate any new supplements or diets to the healthcare provider. Now, let's analyze a hyperkalemia management scenario based on lab values. The nurse is caring for a patient whose serum potassium level is 6.0 milliequivalents per liter. When reviewing the patient's dietary choices, which food should the nurse advise the patient to avoid? A. Rice. B. Raisins. C. Egg yolks. D. The patient can eat anything, as 6.0 is a normal potassium level. Correct answer: B. Raisins. Why? Raisins are extremely high in potassium. With a potassium level of 6.0 milliequivalents per liter, normal range is 3.5 to 5.0. The client is experiencing hyperkalemia, which puts them at risk for dangerous cardiac arrhythmias. Potassium intake should be tightly controlled. A. Rice. Very low in potassium and safe for hyperkalemic patients. C. Egg yolks. Contain protein and cholesterol, but are not high in potassium. D. 6.0 is normal. Incorrect. 6.0 is above the normal range and requires intervention. Potassium-rich foods include bananas, oranges, tomatoes, potatoes, beans, and dried fruits like raisins. Let's move into a case that involves nutrition for wound care, a key area for patient recovery. A nurse is caring for a patient who has a stage 4 pressure ulcer located on the sacral region. Which of the following dietary choices should the nurse prioritize to support optimal wound healing in this patient? A. Liver, spinach, corn. B. Oats, fruits, and vegetables. C. Peanuts, tomatoes, and cabbage. D. Dried beans, eggs, and meats. Correct answer, D. Dried beans, eggs, and meats. Protein is essential for tissue regeneration, especially in patients with deep wounds like stage 4 pressure ulcers. Dried beans, eggs, and meats offer complete and high-quality protein that supports cellular rebuilding and immune defense. A. Liver, spinach, corn. While liver is protein-rich and spinach offers iron, this combination still lacks the sustained high-quality protein concentration needed. B. Oats, fruits, and vegetables. Nutritious, but generally lower in protein density. C. Peanuts, tomatoes, and cabbage. Peanuts do offer protein, but they're incomplete, and the rest are not healing powerhouses. Pair protein intake with hydration and micronutrients like vitamin C and zinc to optimize healing. Now, let's review a dietary progression scenario following surgery, a common NCLEX topic. The nurse is caring for a patient who is in the postoperative period following gallbladder surgery. The healthcare provider has prescribed a clear liquid diet. Which food item is appropriate for the patient's tray? A. Vanilla custard. B. A fudge popsicle. C. Creamy chicken soup. D. Apple juice. Correct answer, D. Apple juice. Clear liquid diets consist of see-through fluids that are easy to digest and leave little residue. Apple juice meets this criteria. It's transparent, hydrating, and gentle on the GI tract. A. Vanilla custard, part of a full liquid diet. B. Fudge popsicle, contains milk solids. C. Creamy chicken soup, contains milk or flour-based thickeners. Clear liquids are short-term, often used after surgery or before procedures. Let's continue with another important post-surgical care topic, wound healing support. A nurse is caring for a post-operative client who recently had a wound vac applied to an abdominal surgical site. To support optimal wound healing, which food choices should the nurse encourage? A. Corn, poultry, and whole grains. B. Liver, beef, and fish. C. Citrus fruits and tomatoes. D. Peanuts, beans, and pork. Correct answer, C. Citrus fruits and tomatoes. Vitamin C is crucial for collagen synthesis, the scaffolding of wound healing. Citrus fruits and tomatoes are rich in vitamin C. A. Corn, poultry, whole grains provide macronutrients, but not vitamin C. B. Liver, beef, fish. High in protein and iron, but low in vitamin C. D. Peanuts, beans, and pork. Moderate in protein, low in vitamin C. Supplementing with vitamin C-rich foods can reduce healing time and infection risk. Lastly, let's shift to preventive nutrition. Maintaining eyesight. A patient asks which vitamin supports vision. Options: A. Vitamin B12. B. Vitamin B6. C. Vitamin C. D. Vitamin A. Correct answer: D. Vitamin A. It supports retinal health and night vision. A. B12. Supports nerve health. B. B6. Metabolism, not vision. C. Vitamin C. Immune support, not directly linked to retinal function. Good sources of vitamin A include carrots, sweet potatoes, leafy greens, and liver.